Good evening. This is All India Radio Kohima. I'm Jonas Yantan with Evening News. The headlines. Nagaland government announces 1 week statewide total lockdown from May 14th. State government says all activities and movement of persons to be suspended during the total lockdown period except permitted activities. Nagaland government to provide compensation of 10 lakh rupees for healthcare workers in addition to Pradhan Mantri Garib Kalyan package of 50 lakh. And GNM and B.Sc nursing and allied healthcare professionals to be engaged in full-time non-COVID essential service duties at government and private facilities. As the number of COVID cases is on the rise, we appeal to our listeners to take all the precautions and all those above 18 years of age to get vaccinated without any hesitation. Stay safe and protected by following these 3 simple steps. Wear a face mask, focus on hand and face hygiene, and maintain a distance of 2 yards for social distancing. Now the news in detail. Nagaland government has announced a 1 week statewide total lockdown from 14th of May. The decision was taken after the high-powered committee on COVID-19 held a meeting today at the Chief Minister's residential complex in Kohima. In a press statement issued from state spokespersons on COVID-19, Minister Niba Grono and advisor Mohalama Kikon informed that after much deliberation, the high-powered committee on COVID-19 decided that there will be a full lockdown in the whole state starting from 6 p.m. from 14th of May to 21st of May. It said the existing restrictions will continue till the total lockdown is in place. However, essential services, including agricultural activities, will be exempted. The committee decided that the government departments will continue to function with a core team formed by the heads of department. It also allowed construction activities to function. However, the contractors and the firms will be responsible for ensuring adherence to all SOPs for the workers. During the lockdown, the health department will pursue aggressive testing, utilizing the full testing capacity of the COVID-19 laboratories. The state government has said that all activities and movement of persons will be suspended during the total lockdown period except the permitted activities. The activities exempted from the lockdown include movement of goods, vehicles, carrying essential commodities, food items, and medical supplies, including oxygen cylinders and other medical equipments. All healthcare facilities, pharmacies, hospitals, clinics, nursing homes, movement of healthcare workers, including COVID-19 vaccination, COVID testing and medical emergencies are allowed. All officers and staff working in Governor's Secretariat, Chief Minister's Office, Chief Secretary's Office, Guwahati High Court Kohima Bench and District Courts, District Administration, Police, Security Forces, Fire and Emergency Services, Home Department, Medical, Postal Services, NIC, NSTMA, Home Guards and Civil Defence, SDRF, Power, PHET, Food and Civil Supplies, Finance, Treasuries and Accounts, Banks, ATMs, IT&C, IPR, AIR, and Dushan, Social Welfare Department, LPGs, private water tankers, etc. are permitted. Petrol pumps are to remain open while ensuring that there is no grouting. District Task Force are to facilitate opening of vegetable shops, fish or meat vendors, bakeries, local grocery stores, hardware, electrical shops for public purchase from 6 a.m. to 12 noon. Nagaland government has decided to provide an amount of 10 lakh rupees as compensation for all healthcare workers in addition to the Pradhan Mantri Garib Kalyan package of 50 lakh rupees. The state government said centre has renewed insurance scheme for healthcare workers fighting COVID-19 under the Pradhan Mantri Garib Kalyan package, which came into effect from 24th of April this year for a period of 180 days. The scheme is a comprehensive insurance coverage for healthcare workers fighting COVID-19 in government hospitals, healthcare centres, as well as private hospitals, whereby any healthcare worker who, while treating COVID-19 patients, meets some accident will be compensated with 50 lakh rupees. This news comes to you from All India Radio, Kohima. You can also listen to this news bulletin on our YouTube channel, AIR News Kohima. The state government has decided to engage GNM or B.Sc nursing and allied healthcare professionals for full-time non-COVID essential service duties at government and private facilities. In a guideline issued to mobilize trained human resources for effective management of COVID-19 pandemic, the state government said students of GNM or B.Sc, nursing and allied healthcare professional courses who are undergoing internship or in final year may be given full-time non-COVID essential service duties at government and private facilities under the supervision of senior faculty, while students who are in second year may be utilized in clinical documentation and other ancillary service. It also said if any interns or final year student of medical professions undergoing studies elsewhere but are presently in the state may also apply for engagement. The government said those health professionals engaged will be suitably remunerated at a rate approved by the state government and will be covered under the insurance scheme of government for health workers fighting COVID-19. In addition, all such health professionals who sign up for minimum 100 days of COVID duty and completes it successfully will be eligible for Prime Minister's Distinguished COVID National Service Samman from the centre, as well as the incentives sanctioned by the state government from time to time. The guidelines further asked the respective hospital administrations to ensure that the medical professionals sought to be engaged in COVID-related works are suitably vaccinated. Centre has asked states and union territories to ensure that all beneficiaries who have taken the first dose are prioritised for the second dose. Union Health Secretary Rajesh Bhushan and Chairman of Empowered Group on Technology and Data Management to Combat COVID-19 and member National Expert Group on Vaccine Administration, Dr. R.S. Sharma, today reviewed the status of COVID vaccination with health secretaries of states and union territories through video conference. Bhushan said states can reserve at least 70% of the vaccines supplied to them from central government for second dose vaccination and remaining 30% for first dose. He, however, said states have the liberty to enhance this to as much as 100%. The Secretary urged states to ensure that priority groups are vaccinated. Bhushan said states have been informed in a transparent manner in advance about the COVID vaccines being provided to them from central government channel. The next allocation for the period of 15 to 31st May will be conveyed to them on 14th May. Government has quashed the rumours that 5G technology is causing the spread of COVID-19. The Ministry of Communications said it has come to its notice that several misleading messages are being circulated on various social media platforms claiming that the second wave of coronavirus has been caused by the testing of the 5G mobile towers. He said these messages are utter nonsense and absolutely incorrect. It urged the general public not to be fooled by fake information and rumours spread in this manner. The ministry said the claims linking the 5G technology with the COVID-19 pandemic has no scientific basis. It informed that testing of the 5G network has not yet started anywhere in India, and they claim that 5G trials or networks are causing coronavirus in India is baseless and untrue. Mobile towers emit non-ionizing, low radio frequencies and are incapable of causing any kind of damage to living cells, including human beings. Today is National Technology Day. The day is celebrated every year on this day to highlight the achievements of engineers and scientists in the field of technology and science. Former Prime Minister Late Atal Bihari Vajpayee coined this term to celebrate the contributions made by Indian scientists. Vice President M. Venkaiah Naidu and Prime Minister Narendra Modi greeted the scientists and technologists on the occasion. And now 20 News, here are the main points again. Nagaland government announces 1 week statewide total lockdown from May 14th. State government says all activities and movement of persons to be suspended during total lockdown period except permitted activities. Nagaland government to provide compensation of 10 lakh rupees for healthcare workers in addition to Pradhan Mantri Garib Kalyan package of 50 lakh. And GNM B.Sc nursing and allied healthcare professionals to be engaged in full-time non-COVID essential service duties at government and private facilities. That is all we have in this evening news bulletin. Good night.